Hi, we're going to talk about 12-lead EKG anatomy. Some old stuff, and I'm thinking maybe some new stuff for some of y'all. The SA node is located up in the right atrium. The impulse is generated there in a healthy heart. That impulse travels down through the left and right atria through the internodal pathways to the gatekeeper, the AV node. This enables the atria to fill the ventricles. The AV node releases this impulse and it travels down into the bundle of His, where it breaks off into the left bundle branch and the right bundle branch, finally getting to the ventricles. Remember that the left bundle branch has an anterior fascicle and a posterior fascicle. Let's talk about what coronary artery supplies the different walls of the heart, if you will, starting with the right coronary artery. The right coronary artery comes off the aorta, and it supplies all of the right ventricle, including the right atria. Then it wraps around the back of the heart, and we'll pause there. Let's go back over to the left side of the heart. The left main, or the left coronary artery, comes off the aorta, and it's going to catch the left atria. And there's going to be a bifurcation down. The first is our LED, or the left anterior descending, which is our widowmaker. It's going to supply blood to the septum and that large portion, that anterior wall of that left ventricle. Now there's some diagonals in here as well. But at that bifurcation, the left coronary artery goes into the circumflex and catches all of the left lateral wall of the left ventricle. Now notice I didn't talk about the posterior wall or the inferior wall, because there's a catch. Well, if it was only that simple. Well, there's a left dominant and a right dominant when it comes to the heart that's in the population out there. The majority of the population, about 85%, have a dominant right coronary artery, meaning that right coronary artery comes off the aorta, supplies the right ventricle, but then it wraps around and supplies the posterior wall of the left ventricle, then finally coming down, catching the inferior wall of the left ventricle. This is important when we look at a 12-lead, to make sure everything we're seeing matches up about what potential dominance we have. The bottom picture shows a dominant left coronary artery where our left main comes off. We have our LED, which is the widowmaker, some diagonals, and then the circumflex comes around, and it's dominant because it catches the lateral wall of the left ventricle, and also then it supplies the posterior wall and finally the inferior wall. With right-sided dominance, RCA dominant, this includes 85% of the population. With this, the RCA supplies the posterior descending artery, or the posterior wall MI, and that PDA supplies the inferior wall of the left ventricle. The EKG will guide you. In the left-sided dominant heart, this accounts for 50% of the population. That left coronary artery supplies the posterior descending artery, and that PDA supplies the inferior wall of the left ventricle. The 12-lead EKG will guide you. Here's the take-home regarding dominance. The inferior wall of the left ventricle is supplied by either the RCA in 85% of the population or the LCA in 15% of the population. Either way, the inferior wall is a distal supply to either coronary artery. So remember, if you read a 12-lead where your machine spits out inferior wall MI suspected, your first 12-lead would have been a left-sided 12-lead, and since the majority of the population, 85%, have a dominant right coronary artery, the standard of care is to do a right-sided EKG. When you do that, all you really have to do is move V4 left and make it V4 right. Now if you want to, you can take off V3L, V4L, V5L, V6L, move it over to the right side of the chest and mirror it. Always remember to write on the EKG that it's a right-sided EKG. With that being said, all you need is 1 block or more of ST elevation in V4R to call that right ventricular infarction. Hopefully you enjoyed this. If you learned something new regarding the left versus right dominance, drop me a comment. And as always, remember to subscribe to my channel, like the video, and turn on your bell notifications.